What if cancer care wasn't just about surgery and scans? What if it also included movement, music, acupuncture, even journaling? Today, we're joined by Mari Galle, an oncology acupuncturist and founder of the Moving Beyond Cancer Collaborative here in Austin, Texas. She walks us through what integrative care really looks like and how it can help with pain, fatigue, anxiety, and so much more. We'll talk about what happens when doctors and healers work together and how patients can bring mind-body practices into their everyday lives. This is care that treats the whole person. You're listening to Kidney Cancer Unfiltered, Episode 4. Well, thank you so much for joining us for the podcast.
Yes.
For our listeners, could you just introduce yourself a little bit before we jump into the topic?
Absolutely. Thank you. Well, thank you so much for having me. So my name is Mari Galle. I am an oncology acupuncturist. So I have my doctorate in acupuncture and Chinese medicine. And I have worked in Austin, Texas for the past 10 years, 9.5 years working in oncology and specializing in integrative care. I founded the nonprofit Moving Beyond Cancer Collaborative 5 years ago, and with the effort or the intention of providing integrative oncology services, free exercise classes to anyone affected by cancer, regardless of the ability to pay. So we saw lots of gaps in comprehensive cancer care, and we're on a mission to solve those gaps.
Our audience.
Yes.
I've known Mari, I think, for going on 5 years.
Yeah.
In the first year, when I first had kidney cancer, you had the NBCC like fundraiser, and I
Yeah.
got involved that way. I think the next year is when I displayed my artwork, and then the year after that, I displayed my artwork again.
Yes.
But we've known each other for a bit, and I've just always loved the mission of your nonprofit, and just how you bring all of these different holistic parts of the healing process together. But I do
Yes.
want to get into it because, we hear the term integrative care a lot. And I think many people
Yeah.
aren't necessarily sure what that means,
Right.
especially when you hear a lot of these like wellness like tips on how to do things naturally. And I think
Right.
sometimes that could get interchanged with integrative care. That
Right.
it's, people just kind of want to stay away from it when it's like, no, it's more. So why don't you break it down for us? What is integrative care?
Absolutely. Yes, yes. That wellness world can get muddy sometimes of what's actually research evidence-based and what someone is suggesting. So with integrative oncology, integrative care is a combination of therapies and practitioners with different modalities. So like physical therapy, nutrition, acupuncture, counseling, all have oncology specialty, advanced training in oncology, and they all work together for your sake. So, um, a difference from like alternative medicine, we are working alongside your oncology team. We want to be a part of it, and we're encouraging you to whatever like treatment path that you're on. We just want to make sure that any symptoms, side effects, concerns for quality of life, they're all addressed, and they can be addressed as you build this team of specialists around you. So I always work with oncologists and the nurse practitioners or the PA who's on your oncology team, and working alongside that, whether it's your chemo regimen, immunotherapy, surgery, building a team for you, is what integrative oncology care is.
That is such an
I hope that makes
easy
sense.
explanation,
Oh,
because
thank you. Yeah,
yeah, it's such a, and I mean it in a good way because it's like, I think again, things get interchanged, alternative gets
right.
integrated, when really it's just about working together with these different types of ways
Absolutely.
to help your quality of life improve, not just physically, but also emotionally. And now you mentioned some practices that can
Mhm.
be a part, and acupuncture being one of them. But could you share some practices that would
Yeah,
fall under integrative care?
definitely. Yes, it's a long list. So there's massage, acupuncture, physical therapy, occupational therapy, nutrition, counseling, music therapy, art therapy, as well as exercise. So meditation, yoga, cardio classes. There are wonderful physical personal trainers who also have advanced training and working in the oncology population. So you can kind of pick and choose what resonates with you, or you can talk to an integrative oncology practitioner that can recommend what's best for you or create a little treatment plan for you, just to kind of build your community. Like they say, it takes a village to raise a child. Like when you have this diagnosis, you got to build your village around you to help figure out like who's going to help you support like the mind, body, and spirit while your oncology team is treating the cancer.
That's amazing. And the fact my eyes lit up when you said about like fitness coaches who've done a lot of like advanced oncology like
Mhm.
work. And now I'm like, maybe I need like career pair change because I would love that.
Yeah,
Um,
I can send you some resources. It's a
please,
wonderful field.
I
Yeah.
really please do. But to that, so what practices, and I ask this question because for kidney cancer, our treatment options are varied, but we don't have chemotherapy, right? Like if you're stage
Right.
one, stage two, it's typically usually surgery, and depending on the type
Right.
um, of cancer you have and type, the type. And also, even in stage four, it's like immunotherapy and radiation and ablation and all these different things. So, which practices would you say could be most beneficial for kidney cancer patients?
Totally. So if we're talking about just surgery, I know a lot of people are on immunotherapy, so we could chat about that as well. But before we go into surgery in general, we want to make sure that our inflammatory markers are low if they can be. Um, Doing practices that increases our oxygen intake, so qigong or cardio or meditation with breath work. That's all very, very helpful. Um, Acupuncture is great for stress relief as well as pain management. And there are, there's some research for kidney function as well that acupuncture can help with. So working on that like before surgery, after, and figuring out that balance is really helpful. Um, so those are some things. Depending on if there's any like scar tissue after the fact or muscle tension, like around where the surgery was, that's also something that can be addressed with physical therapy.
No,
And then, immunotherapy, we can talk about those symptoms too, if you want.
yes, definitely. Before we get into that, I'm interested in
Yeah.
the acupuncture and kidney function connection. Could you explain a little bit more about that?
Yeah. So there's small amounts of research in Western medicine and Eastern medicine from a Chinese medicine perspective, acupuncture, that we have our kidney channel as well as our bladder channel. And there's a channel, energetic channel for every organ system that you have. And um, there are different points that can improve like kidney filtration rates and like processing or quote unquote detoxing when you've gone through chemo or when you've gone through surgery, excuse me, um, that it can help make your mind feel a little bit more clear after the fact. So mental clarity and yes, the just the processing of the energetic channel.
But yeah, so there are a few things I want to mention. I think the first thing I want to get into before we talk about like surgery and immunotherapy and kind of those
Mm,
connections is there a time limit on integrated care? Because I think one thing
yeah,
survivors, struggle with, it's like, okay, well, I'm a year out of my surgery or I'm a year out of my treatment. Do I really need this stuff still? But then I think about my own journey and other people's journey. We're 5 years into it, and there's still some things that like we're dealing with the long
right,
term effects of having just like one kidney, for example, and plus the trauma of
right.
cancer. So I know it's a very long winded question and with some background, but can you talk about like integrated care and like the length of survivorship, if that makes sense?
Absolutely. Yes. So we encourage, it doesn't, I have patients that 5 years ago, they were diagnosed, 10 years ago, they had treatment, and they're just now realizing, like, oh, like my chronic back pain doesn't actually need to be there. Or maybe there's some like pelvic floor issues that can be addressed. So there's never like a time limit post treatment. And especially with our nonprofit, we don't have that as a barrier. Because sometimes especially with like the emotional aspect of cancer. A lot of times people are in survival mode when they're first diagnosed and they're going through treatment or going through surgery because they have to get it done. And it could be 2 years later that it hits them of this reality, like, oh my gosh, I had this diagnosis, I didn't process it, and now all these like feelings are coming up, insomnia, stress, or it's manifesting in some other way. Um, so you always have your team. You can always build your team, especially if it's years down the road. If symptoms are still there, or if you need that support, then that's what we're here for.
I love hearing that because I think for myself, like this year, I really focused on healing through creativity. And so I've been
Yeah,
doing a lot more painting and a lot more writing. And I just say that to say, like, to your point, it's like
right.
I'm gonna be 5 years in October, and now I just realized,
Yeah,
oh wait, like I have not really healed. Let me tap
right,
into that part of myself. But
right.
speaking of that, Carrie, you mentioned immunotherapy and surgery, and then different types. So, how does an integrative approach fit in with standard treatments for like surgery, like immunotherapy? And you can answer them as like two separate things. So it's,
Totally. Okay. So when someone is going through immunotherapy, and sometimes people do like cisplatin or platin drug with kidney cancer, but it's not often. But when you're starting immunotherapy, I often see people at least once a week at first as an acupuncturist, when symptoms come up. And I try to create like a treatment plan for them of an integrative oncology treatment plan. So an example of that would be at first when immunotherapy starts, let's start doing acupuncture and checking in of like what symptoms are coming up. Like, do you have digestive issues? Are you anemic? Any anemia signs? Or how's your oxygen? How's your like pulse ox going? Do you need any support with like qigong? So I'll chat with someone, figure out where they're at, and try to support or work ahead of nausea, pain, digestive issues, sleep issues, and that's with acupuncture. But then I'll suggest like let's also add in things that you can do at home. A lot of integrative oncology therapies are actually like self-care, and you just need to learn about it. So what about like 5 minutes of qigong or tai chi every day? Because we know that that can increase blood oxygen levels throughout our body because we're moving. We're moving and doing breath work at the same time. It's wonderful for like neuropathy, stress, relaxation, helping like move that stuck energy out when you wake up and you're stressed when the morning is just going. So I'll often recommend some type of movement therapy, and you can pick and choose whatever that looks like. And let's start with like a gentle movement first. So gentle yoga, um, or the movement, the qigong, tai chi, something that has a meditative element to it. And then we can always like layer in nutrition is wonderful and so important, and that can feel daunting for people. So I usually just recommend a few food therapy recommendations first, and then if they'd like to incorporate the oncology dietitian, then we will make like a once a month appointment with him or her to help a patient through that. So layering an integrative oncology approach is really like layering the modalities. Um, for you that doesn't feel overwhelming, but feels like you have the support and stuff that you can actually do at home.
And you mentioned movement and nutrition outside of like things that can be done or should be
Right,
done by an expert. So how
right.
important is it to make sure movement and nutrition are integrated, if you will, into
Yeah,
integrative care?
I think it's incredibly important. Moving just in someone who is not going through cancer treatment, keeping your body moving every day is really important. But then when you are going through treatment, putting that first and putting your health and wellness first, because a lot of people are healthy who happen to be diagnosed with cancer. It doesn't mean that you are unwell. We want to keep you well while your body is being treated with this cancer. So finding some type of movement for you to do is incredibly important. We know that exercise during and after treatment decreases the risk of recurrence. So let's figure out what you like, and let's do it even 10 minutes a day. It doesn't have to be intense. Like that's why we have free exercise classes with our nonprofit. But Memorial Sloan Kettering has free exercise classes. Dana-Farber, the Cleveland Clinic, there's so many resources online that don't have to cost you anything. They don't have to take a lot of your time, but you should really do that. And then with nutrition, I think nutrition is really important, but also I have a lot of conversations with patients where they're hard on themselves if they have a piece of cake or have cookies. Like we want you to enjoy life. But like there are also just some standards that you can incorporate into your diet. Um, if you're going through treatment, there's, increasing protein levels. If we know, like if you've had surgery, making sure you're having high protein levels so your body can heal, but then working with that oncology dietitian to make sure it's not too much so your kidneys can process and filter. So that's the importance of having an oncology dietitian working with you and someone who's actually like an RD, not that wellness, you know, so not someone who is a food coach or something like that.
Yeah, because I think that's one thing, and I'm sure you've seen it too, where you have these like alternative, like wellness people who are like, you should not eat sugar because it'll lead to
Hmm.
cancer. We know is
Right,
not true. Or
right,
like you'll have people like, well, I never got cancer because I ate this way and I ate clean, and
right.
it's not
That's
that's
not
not
how
how
that
it works. Like
works.
you didn't get cancer just because you had a piece of cake at
No,
your son's birthday. Like it's not.
no.
So I appreciate you making that point, and
Yeah,
even like the nutrition part of like there are people I mentor myself who are very concerned about their nutrition and that they feel like they did it to themselves because they ate a certain,
right,
it's like, and then and I think it's part of trauma, right? Like you'll
right,
look at stuff and it'll be confirmation bias because you want to confirm to yourself that, yeah, you're the wrong one, right? Like it's that
right.
kind of like just trauma thinking.
Totally.
And I just have to, remind them like, that person probably would have never had a recurrence even if
Right,
they ate a certain
right.
way, right? Like them
Totally.
eating veggies only is not why
Right,
they get cancer. So I appreciate you
right.
bringing that up.
Yeah,
And I say all that to say, what are some of the common misconceptions that people have about these therapies and holistic care? And I think, again, nutrition is one of them, right? Where it's this idea
right.
that like you have to eat a certain way and that's alternative
Yes,
then to treatment and you'll be better. But like, what are some other
totally.
misconceptions?
I think I see a lot of misconceptions with integrative care that maybe it needs to be either or and not also.
Yeah.
So a lot of people think sometimes I do have patients come to me because they don't trust Western medicine or they don't want to do standard treatment. And I have to explain to them that like you can't juice your way out of a cancer diagnosis, unfortunately. Like it's a really hard thing to do, but like unfortunately we do need integrative means having both and maybe having the best of both worlds. But it's not alternative. And I understand that there's a world where that goes on, but that's really not my world, and that's not the world that we've created with the nonprofit. So that is one big misconception, and I think sometimes people think they don't need it until there's something wrong. But
Mhm.
having that team or that group ready to go with you is wonderful to have at the start of your diagnosis. Because sometimes like we can see you more than even your oncology team, right? Like when someone's like in it, I'm seeing them every week or twice a week, and I can like pick up if oh your sleep isn't as good or like wait, what's really going on with your digestion, maybe check in with your oncologist about checking in with a GI or consultant or specialist or a dietitian. So that's one misconception is like it's either or. And then um, another misconception is thinking that you have to like wait until something is wrong. Like you don't need to do that. It's like getting started right away is always really helpful and focusing on like your health and wellness and from your mind, body, and spirit, not just when you're unwell. And then I think another misconception is that like there isn't evidence-based backing for these services. With things like acupuncture and Chinese medicine, there's like 3,000 years of clinical practice, but now there's also wonderful Western medicine, like Western research happening with oncology acupuncture and with massage and with yoga showing that it does have a huge positive effect for people who are going through treatment or have been through treatment. Like the Society for Integrative Oncology is a wonderful resource where you can find um, find practitioners, find research to back what you're interested in. Um, so I think those are some of the big things that I tackle.
Do you think some of that comes from and I may not articulate this well enough, but like comes from the want and need to just get treatment over with, right? Like I think about,
Yeah.
again, the trauma of cancer, the immediacy of it, right? Where people are
Mhm.
just in the space of, okay, I just want to get my surgery done. I want to be done with it. I don't want to think of cancer anymore. I'll be
Right.
fine. Do you think some of that may play a role in how kind of people approach integrative care?
Really, or like, or maybe not reach out for it, do you think? Is that what you're asking?
Yeah, both
Yeah,
what you think
absolutely.
about it and whether or not they get started right away.
Right. And it does feel daunting, right? Like you've just been diagnosed. You want to go like the smoothest, easiest, fastest path out of this storm. Um, and taking a breath to create a plan does feel a little bit more like reality is hitting you that this is happening. Um, so that is often, I see that often. Sometimes I have patients that they don't even know the stage they're in because they don't want to know.
Hmm.
Um, and they just want to get through. So I'll meet them where they're at, and then once treatment is over, they have some time to reflect, and then we kind of peel back the layers of what it would have been wonderful to know at the beginning, but that's okay too. Um, but like dealing with the symptoms, side effects, and like the emotional aspect of all of it as well. Yeah,
Now, what about physicians and oncologists? I know you work
yeah,
closely with oncologists, but do you often find that they're receptive to it and referring out their
right.
patients? Do you find them more saying no, don't do that? And
Mhm.
if it is the latter, like how do survivors find those resources for themselves?
Totally. And it's a mixed bag. Here in Austin, it's a mixed bag. I think everywhere. I'm from Wisconsin. My undergrad was near the Mayo Clinic, where they're very open-minded to integrative care. So I think I came from a place that physicians were much more open-minded, but it's really just an education element, where they don't want, I think oncologists do know that there is like the wellness world out there that might be telling them things that are not accurate. Um, so they don't know who these people are. So really just educating the oncologists of who we are, what our training is, um, what our like school of thought is and belief system with supporting cancer patients and not being an alternative option is really important. Um, and then chipping away at like making this affordable. So like the I've had some practitioners, oncologists say, "Oh yeah, that's great, but I don't refer to you because it's too expensive." Or like they might not know like I take insurance. And like because if cash pay is not an option, that's why we have this nonprofit model that people pay what they can donating. And if they can't, we have a charitable care fund. So some people pay $5 and that's great. Some people pay $40, wonderful. But regardless, it doesn't matter because we have fundraising efforts. No one gets turned away. So I know a barrier for oncologists to not embrace these services is like they don't want to have to tell a patient, this is wonderful, this is going to help you. And then they realize, well, now I can't afford it. Like cancer is expensive and this is one more expense. Um, so there's a lot of education that has to happen and is happening and needs to continue to happen to in that communication with oncology teams. And also just building that relationship of trust.
Um, so I guess, how can survivors help educate their physicians? I mean, there is obviously a responsibility on the
Yeah,
part of integrative care practitioners, but what about survivors themselves? How can they help bring this, more, make it more popular,
together.
if you will? That might not be the right word, but that's what we're going with.
But it is. I mean,
Yeah.
I tell a lot of my patients, like, you need to like report back that this is what you would like in your care. Ask for it. Ask the oncologist, like, have you heard of XYZ? Or have you heard that exercise is really great for this? I've been doing this yoga. It's helping me. Really just because oncologists want to know like really what patients need or want. Like they do appreciate that feedback. So if there are survivors, if there are people going through treatment that want a script for physical therapy, ask your oncologist for it and their team. You know, there's social workers, there's nurse practitioners that can help reach out and find those providers in your area to help you. Um, I do ask my patients a lot, like when they start to feeling better, still feel better. I'm like, oh, well, please make sure that your oncology team knows that. Like, I'll put it in our notes and communicate, but it's always wonderful to hear from you. Because I think that helps more than having and practitioner like myself tell the oncologist, this is all the great things that we can do, it's better to hear it from the patient themselves.
Now, you mentioned, or like we talked earlier about movement and nutrition. Now let's
Hmm.
talk about mind body practices. So, like meditation,
Hmm.
acupuncture, your specialty,
Yeah.
those help. Like it's particularly kidney cancer patients. We know acupuncture and kidney function, but how can other body practices help during treatment and recovery, and even into survivorship?
Totally. So with the mind body aspect, so meditation and guided meditation, breath work, yoga, gentle flow type movement therapies, it can help with a lot of, yes, kidney cancer patients as well as like other cancer patients as well. So symptoms that are like fatigue, stress, low back achiness, pain, um, those are all incredibly helpful with these modalities, and just making sure that your mind is grounded through treatment is really important, because it's a cancer diagnosis is such a mind game that no one prepares you for. So figuring out what modality you like. Some of my patients absolutely hate meditation. That's fine,
I'm
but they'll, yeah, it's okay. But can you like do breathing for 3 minutes? Probably. Like you could maybe handle that. Or you can go on a walk and just like notice what's around you. Like do be have like mindful actions in your day. That is part of that mind body connection of like noticing the trees and leaves around you, noticing your breath as you're walking. You don't have to like sit and be still. If that's not your jam, that's fine. But incorporating something is really important just for your overall health.
Yeah, and I think, and this is not necessarily just related to cancer because
Yeah,
mindfulness my life in other ways. And in my day job, we talk about it in terms of organizations and
yeah,
working. But it's really interesting because I think people tend, how do I put this? I feel like as a society, we have this kind of all or nothing mindset. And I think when it comes to mindfulness, it's the same thing. It's like if I'm going to do
yeah,
mindfulness, it has to be meditation. But like you said,
yeah,
if you hate them, and I'm honestly, I tried, I
yeah.
just, my brain
It's okay.
does not want to do it. It just does not
No,
want. But
that's
I try to
fine.
find other ways to be mindful, like even
Yeah.
just petting my like animals for like 10 minutes straight, you know? Um,
Yes.
so I love that you brought up the fact that it's not something that needs to be like this hour-long practice. Like you could do
No.
something simple. And
Right.
I want to talk about what can, in addition to like going to a nonprofit like yours or other places,
Sure.
what can people do for themselves at home to get started?
Like, okay. So, um, figuring out like what you're interested in. So let's say if you're really interested, like there's not like an in-person yoga class nearby, but there might be something online. I would write out, if I was like new to this, I would write out things that I know that I do like to do. Whether it's going on a walk with my dog. Can I leave my cell phone at home while I go on that walk, or can I put it in my back pocket and not touch it? Keep it if you need something, but making like very small steps into self-care is really important, and that's kind of like the base of what integrative oncology is. There's, as far as like nutrition goes, there's a great book called the Cancer Fighting Kitchen Cookbook. I don't know if you've ever heard of it. That's one book, but if nutrition is like new for you and daunting, um that book is a wonderful resource because it tells you, like, based on what symptom you're having, recipes you can add into your day, vegetarian or meat, animal-based protein. Then there's also like where you're at in treatment. Like if your white blood cell count is low, let's try these meals, or right before surgery, this is great, or radiation, blah, blah, blah. It goes on. That's a wonderful resource that I know a lot of dietitians will use. There are free videos online. Dr. Crystal Zuniga is a registered dietitian and oncology nutrition researcher here in Austin, and she has amazing videos like on her Instagram and on our website, our nonprofit's website, like a one hour food therapy or nutrition through cancer and after cancer that you can just like watch. So that's something really simple that you can do at home, and just starting to like piece together little things. There's acupressure you can learn. Like if you're feeling nauseous, there's wonderful like acupressure points. Like this is a wonderful point about 3 finger lengths from your wrist, on the inside of your wrist that you can press on. So maybe incorporating acupressure into your day. That's also something you can do at home and it's free. Um, Journaling, mindfulness, or tapping therapy is something that you can also expand on if you want. But tapping therapy is something that a counselor can teach you or you can learn online that can help get your head right when you're feeling anxious or stressed or haven't slept well.
Yeah, I would
Great too.
love to hear more about like what tapping therapy is. Like anything
Yeah,
that people can do at home. I'm sure our listeners will appreciate anything that is within
absolutely.
themselves.
Totally. Yeah. So, even I'll start with just like even a simple acupressure point. So, if people who are listening at home, I'll explain to you where the point is, or seeing on the video here on your earlobe at the top of your ear, we call it like the little fish head here, the inside of the curve, top of your ear, that is the ending of the vagus nerve. And the vagus nerve is part of our fight or flight, our stress response. If we massage that, needle that, press on it, and do breath work, it can calm that fight or flight response down and calm your sympathetic nervous system. So that's something that you can do every day where I'll just press and do some box breathing. So like breathe in for 4 seconds, hold for four, breathe out for 4 seconds, and hold for four again. Um, that's something super simple you can do. It can help with stress. It can help with nausea, anxiety, um, and just like kind of getting you back into your body. And then tapping therapy is really interesting. So you tap specific acupressure points while you have an like an affirmation statement that you say out loud. Yeah. Okay. So we would do tapping therapy where we tap there's a point here at the very top of our head, and then you can tap above your eyebrows, below your eyes, right underneath your nose, above your lips, right below your lips, on your clavicles, and then the side, your lap, like right where your ribs, on the side of you, and then your wrists. You would also tap. So tapping. Oops, sorry. Go ahead.
Or
Yep. Yeah.
okay.
Some people will go like this, or I just like press or go like that. Um, and you say that you are feeling anxious. So you would say the negative statement, like, even though I'm feeling anxious right now, then you say a positive statement, like, I love and accept myself. And you go through that as you're tapping. And it's somewhat similar to EMDR, which is like a biofeedback process that therapists will talk you through. Uh, but it's something that you can do at home. So tapping therapy like that, you can Google it online and there's so many different videos of explaining how to do it and walking you through it. That's something also you can like put in your resource bag for you that you can do at home. You can do like if you're anxious to fly, if you're anxious for your next scan, um, doing that in the waiting, in the bathroom in the waiting area before you go in to meet with your oncologist. That's really helpful.
Why
It
is it helpful?
it's a process of when there's trauma in our body or mind, the right and left brain parts of our brain sometimes are not communicating and our stress anxiety is stuck. So the tapping while the talking, it's similar to like EMDR
Yeah.
where your right and left brain are working together at the same time and you're able to like process whatever that trigger is. Um, it's really interesting. It's a newer concept, but uh, counselors are using it. They use it often, in conjunction with EMDR.
Interesting. That's really interesting.
Yeah.
Now, so those are really great like self-care practices that
Mhm.
we can try at home. But let's say you do want to be more a part of a practice or work
Yeah.
with a practice. What should people look for when they want to explore integrative care practices?
Mhm.
Don't know where to start.
Definitely. So if you're in an area that there isn't a cancer rehab center or there's not like this integrative oncology clinic, you can at least look up practitioners, and then the national database, that Society for Integrative Oncology website has the directory. So people who are a part of that usually have had advanced training in oncology care. when it comes to specific practitioners, so massage, there is oncology massage training that massage therapists can take, as well as manual lymph drainage training. So if you ever get a massage, it's really handy, especially if you are in active treatment, to go to someone and to not only handy, but advisable to go to someone who's an oncology massage therapist. Because there are things to um, there's things just to consider with like your lymphatic system, like what's going on with your immune system right now. And you don't necessarily need deep tissue. Like if you've had surgery and lymph nodes have also been removed, we want to be mindful of what lymphedema is and not doing anything that could poke the bear with that. So looking and seeing like what is their extra training? Do they have oncology, advanced oncology training? Um, do they have manual lymph drainage for massage? That's huge. For physical therapy, that's the same. Like there's extra advanced training that a physical therapist can take to be an oncology physical therapist. Same with acupuncture, nutrition. I nutrition really it's more of like a specialty. Like what is that person studied? But a lot of like cancer centers will have at least one dietitian available for people. Um, if not, then there's the free online resources. And the with personal training, it is really important to find someone who has oncology training because sometimes when we're tired, if you're not going through treatment and you're tired, you push yourself and then you feel better after exercising. That's not always the case when you're in treatment or just recovered from surgery. If you're tired, you don't necessarily want to push yourself, and that doesn't always bring like a positive result. So working with someone who has that advanced knowledge is really important for your safety.
Yeah. Now, we did an episode last season on palliative care, and we
Okay.
spoke about how, same thing like with integrative care, like palliative care does not equal hospice, right? Like hospice might
Right.
be the top floor, but it's not, or but it's not palliative care. And we know that palliative care is more for people who are, or rather it's available to everybody, but a
Right.
lot of people who are in like late stages, advanced stages are more apt to take palliative care. I say that all to say, we also talked about, how earlier stages can be a part of palliative care too. Kind of, they
Mhm.
have the same services, but I would love for you to kind of break down or maybe explain how integrative care and palliative care kind of work together, like how they're part
Yeah,
of the
absolutely.
spectrum, if you will.
Absolutely. Yes. I work a lot with palliative care practitioners, oncologists, pain management doctors. So and like that episode discussed, like palliative care is available for everyone. Like no one should be in pain or discomfort, and it should be available in early stages as well. Um, so integrative oncology services are wonderful to work alongside palliative care. I have a few patients right now that have a great palliative care doctor, and if I know that they have like fentanyl patches or like they're on certain THC prescriptions,
Mm.
um, then I can kind of adjust what I'm doing in terms of like pain management. Acupuncture is wonderful, but if you're on opioids, it might not work as well, funnily enough. So if I know that, then I can do different points, or I could do something called electrical stimulation on a point, um, just to work alongside. And also like sometimes there's side effects to those opioid drugs. So we can work on constipation or digestive issues, or there's appetite, encouraging appetite points that we can also do. That is great. So we work alongside that all the time. I work in palliative care, I work in hospice, I work for people just newly diagnosed to end of life care. And it's really important just to be alongside patients throughout wherever they're at.
Yeah, I really love how, and again, it's using the word to describe the word, right? Define the word, but I really
Yeah.
do love how like integrative care is,
Yeah.
because I think again, and healthcare and health needs to be a continuum, and like
Hmm.
to be siloed, and that's one thing
Right.
we talked about in that episode, and just in general throughout the podcast is just how so many parts of cancer care can be so siloed, and
Yes.
it doesn't, you're left a lot, like survivors are just left a lot like, I don't have the mental health care that I need because my
Right.
my oncology office doesn't have like more than one social worker, or
Right.
I'm doing yoga, but like your doctor doesn't know about it. Just there's
Right. It's
cheap examples.
fragmented.
Yeah, it's very fragmented. And so I love how you kind of bring it all together. So, where do you see integrative oncology headed in the next few years?
So my dream is to make it not fragmented. So my goal, and my my career purpose is to make sure that this keeps growing. So um, this nonprofit I have, we constantly are getting calls or emails like, "Hey, what's the MBCC version in Dallas?" or "Where are you in Chicago?" And we're not there yet, but we could create a model that can be adopted into like mid and smaller cancer centers. So integrative oncology right now is at MD Anderson, it's at Dana-Farber, MSK, the Mayo Clinic, but it shouldn't stop there just because those are huge cancer centers. So I am hoping in the next few 5 to 10 years that this, education will spread about how incredible it is to have your team, and that this model can actually be in like mid to smaller cancer centers and be available for, you know, my family members who live in rural Wisconsin, as well as the bigger cities. So it's exciting. We're in a very exciting time, but uh, a lot of work needs to happen, and I think we're gonna get there.
I agree, because it just the last few years, I honestly, I feel like so much has changed in the last
Mhm.
in general, a lot has changed in the last
Right,
5. But I think if I think about it in my cancer journey, and I've had conversations with my survivor friends, particularly in the kidney cancer space, it feels
yeah,
like has been a lot of progress that has happened over the last 5 years. And I think around, our thought processes around integrative care and
right,
really bringing it more into the care journey, I think
right,
that's changed a lot. I think, and from work that you've done, work other places have done to like really
right.
educate the public on it.
Yeah.
So
Oh, thank you. Yes, I think people deserve it. Like I come from a family member. I have several family members that have had cancer, one family member who had renal cell. And they didn't get the care that as far as comprehensive integrative care that they deserved and that I wanted them to have. So that's like why we started this to begin with. Like I want this to be available, and I want the education to be there. I want the access, the
yeah,
accessibility to be there for everyone, because everyone deserves that. Like your mind, body, spirit, side effects, symptoms, quality of life is just as important as the cancer also being treated. Like we of course need that to be treated, but you need to be yourself throughout the journey as well. And you need to feel like yourself. So that's what these services do. That's what people deserve. Yeah.
yeah. And I think the access part, I think that's what I know.
Yeah.
One of the things I love about your nonprofit is how it breaks down the barriers to access, because
Yeah.
and I know this is going over the 2 questions I had, but,
Yeah.
you gotta add more sometimes. Because the fact is, like, if you go to a massage therapist, it is like $180 for, like, 90 minutes,
Yeah.
and honestly, if you're paying co-pays and, like, a deductible on your
Right.
cancer treatment, or, like, whatever long-term side effects you're
Right.
experiencing after your treatment, you're not gonna drop 180, and
No.
s like, making it available, making it sliding scale, and meeting people where they're at so they can have access to some
Right.
important care, that is just an amazing thing that you do.
I just agree with you. Like cancer is expensive. It doesn't matter where you're at and your like demographics. Like it will drain you, and and if it's a medical massage or medical something you need to go regularly, no one no one can justify dropping $800 a month for your neuropathy treatment so you can get massage. Like that's a huge barrier for I don't everyone. Um, so yeah, I think that is one thing that integrative oncology care can do better at, is filling these gaps and making it accessible. We have work to do as well. So yeah.
So my last question, what my second question
Yes.
was, is we talked a lot about different things. Is there anything that you would like to add that maybe I didn't touch on in my questions?
No, this was wonderful. I think if I could just encourage people to figure out like what type of care plan would they love to have, and creating a plan for themselves. I know this, we chatted a little bit about it today, but looking at different practitioners and modalities. And I really would love to encourage people to create a plan for themselves, adding in, one level of mind body practice a week, one level of exercise, maybe some foods that we can add that we know can help with, um, making you feel better, or checking in with a physical therapist. Are you as strong and as well as you feel like you want to be? That's great. So I work a lot with people to just create a plan, but that's something that people can do at home, because there are so many resources available. So really just encouraging you to like think about like who you want your village to be and how you can add that to your, I hate the word journey, but add that to where you're at right now.
Yeah. I started using Experience. Like I used Journey at
Oh, I
first.
like experience. Yeah.
Yeah. But then like I started thinking about it more, and the conversation is always around like, is it really a journey? Like there is no
I know.
destination because you deal with it the rest
Right.
of your life. So I
Yeah,
started using Experience.
that
I
sounds
think a
great.
good
I like
alternative.
that.
Well, thank you so much for
Thank
joining us.
you.
Before we go, I would love you to let everyone know where they can find you
Oh,
online, and
sure.
also, for our listeners based in Austin, like myself,
Okay.
where we can find you, the actual physical address. Maybe that, yeah, or
Absolutely. So if you ever have any questions, my email is Mari, Mari, at mbccollaborative.org. Um, or just marigalle.com has all of the resources as well. mbccollaborative.org is our website. And then if you're in Austin, our physical location is 1306 West Anderson Lane. So North Central Austin, but we also have our free exercise classes in person, one in Round Rock, one in Northwest Hills. We're adding one in Cedar Park. So we're here. We're just and we're really excited since we have such a wait list at our current location. We're excited to start looking into South Austin and Williamson County, so north of Austin. So always happy just to help guide people whatever they need in terms of resources. Even if you don't live near me, that's fine. I can at least send you some resources of where you can get help where you are. I do that often. It's never a problem.
Thank you, Alexis, for supporting this episode of the Kidney Cancer Unfiltered podcast. Thanks for listening to Kidney Cancer Unfiltered. If you found this episode helpful, be sure to like, share, and subscribe wherever you listen to your favorite podcast. For more resources and episodes, visit kidneycancer.org or follow Kidney Cancer Association on social media. Until next time, take care, and remember, you're not alone.